48 minutes after 7. Welcome back and thank you for staying with us. Njengoba besishilo ke nakuqala lihlelo ukuthi Dr. Kudzai Ndlovu loqhamuka at the clinic group will join us. Kuto ukhulumisa indzaba yema abdominal pain. Siyakhumbula ukuthi last week Lungelele spoke to Dr. Maforo ngema foreign bodies in children, and the week before that we actually spoke about asthma in children with Dr. Newton. Lamuhla ke we talk about abdominal pain with Dr. Kudzai Ndlovu. All questions long about now mayelana nalogo, what it is, its common causes and diagnosis. Nalogunye nje longafuna kwati siyakudiscussa nyalo. Dr. A very good morning. Thank you so much for joining us. How are you?
I'm all right. Thanks for having me.
Yeah, thank you so much for coming through. Let's talk about abdominal pain. What are the common causes of abdominal pain?
All right. So abdominal pain is a very common symptom. Most of the people that I think everyone has encountered abdominal pain at some point in their lives. So most of the pains they rarely present to the hospital because it's just self-limiting. All right. Yeah. So in terms of cause of abdominal pain, we tend to then want to sort of classify the causes based on the following: whether it's an infection. So infections tend to also give you abdominal pain. Let's say food poisoning or infection from any other cause. So let's say if you've got diarrhea, you will have a bit of abdominal pain or cramps, as we commonly put it. All right. And then at times when you trauma, for instance, when someone is when you get beaten, definitely you feel pain. All right. And then there's a common one. Let's say when you do sit-ups, you can also get abdominal pains, right? Because when we say abdominal pain, we refer to any form of pain that is below the ribs, going to the area between the groins. So anything around this part. All right. So that area has muscles, has the internal organs, like the intestines, your appendix. I'm sure people have at some point spoken about appendix, appendix or something like that.
Shouldn't eat white bread, all of that. Yeah.
So appendix can also cause pain. And then in females, the key one is the organs like ovaries and the uterus itself. That could be also a source of abdominal pain. So one of the key things that we normally do is to make sure that we ask anyone who's of reproductive age their last menstrual period, because it's key, since there's life-threatening disorders that we'll need to rule out so that we save lives in the process. So it's quite a lot.
Yeah, to me, as you're explaining it, it seems like the abdomen is such an area where, a lot can happen. And so how do we take care of our abdomen? Because like you said, almost everyone has had some sort of abdominal pain, but I'm sure there are those ones that are more serious than others. So for instance, as a gym bro, I go to the gym. I do have abdominal pain from the sit-ups, as you mentioned, and I suppose those are the ones that are not very serious, that can go away. What are the most serious ones, and how do we know that this is one that I should attend to the clinic group as soon as I can?
All right. So in terms of serious, I think one of the key symptoms is, let's say, when the pain is so severe that you cannot do anything. It's worsening in severity, and it's most of the times it's that type of pain that is of sudden onset and it's severe. Please make sure that you seek help. All right. And then there's the other type of pain. Let's say if you've been involved in an accident and suddenly you get severe pain, it may actually signal that maybe there's internal organ injuries. You definitely need to seek help. And in some cases, when the pain is associated with other symptoms like extreme fever or diarrhea and all those things, please seek help. And then key to also note is that we do have things that can be done for all those conditions. Then we can test so that we can be sure what exactly is the problem.
Right.
Yeah, without assuming.
Yeah, and I think, I don't know, you'll correct me here. My general assumption is that ulcers, from what you've described as abdominal pain, I'm looking at the abdomen, ulcers is the most common one. And, I do have a few relatives that have ulcers and a few friends that do have ulcers. It can get tricky. It can get quite serious. And I always see them, some of them take cayenne pepper. And, as I'm from the outside looking in, I'm like, but cayenne pepper is chili. It's hot. Isn't that going to exacerbate? Let's talk about ulcers as the most common, I assume, most common abdominal pain.
Right. Okay, so ulcers, I think every other person on the street, whenever they get some form of pain, they think it's ulcers until proved otherwise. And yet there's all these other organs. By ulcers, I'll start by explaining what ulcers are. Really, we're talking about an erosion of the surface of the stomach or the first part of the intestines, which we call the duodenum. All right. So where it's basically like a slonda.
Yeah.
Just an open wound, right?
Yeah.
Where if then acid or whatever touches, then you feel pain. So you typically feel it around this particular area,
Okay.
the upper part of the abdomen.
Yeah.
All right.
Yeah.
And most of the times it goes hand in hand with other symptoms.
Right.
Like you're bloating, full of air, and then you feel like throwing up most of the time, a bit of constipation, and some people also report things like slungulela.
Yeah.
You know. So those are some of the things that happen. And commonly, one of the common causes of ulcers is these over-the-counter medications that we normally take. Like your grandpa, for instance, after a heavy night of drinking or something, you know, recurrent usage of that can actually give you ulcers because it's got aspirin, a certain class of drug that is commonly implicated in that as well. And then you have your diclofenac and the other types of medications like ibuprofen that people commonly give each other to
Over
friends or whoever. Say, okay, in or whatever, then just take this, you'll be fine. So, and yet those things actually have side effects as well when used excessively. Yes, so that's one of the key things on the ulcers. But what I've seen, okay, cool.
Yeah.
In terms of diagnosis, so there's the gold standard is actually visualizing the ulcer.
Okay.
All right. So where we do endoscopies, so we do them at the clinic where they actually insert a camera. They go inside the stomach to actually look around and survey.
So sorry, doctor. How do they do that? Is it inserted through your mouth?
Through the mouth, yes.
A camera through your mouth?
Yes.
How big is this camera? Okay, anyway, keep going. How do you diagnose it?
All right. So it's just it's like a telescope.
Yeah.
But then we normally use it under light sedation.
Okay.
Where then you take it in throughout. It's flexible, so it moves in nicely. It's not just rigid or whatever.
Yeah.
So the idea is to try and survey and look for any areas of whether what we call erosions or ulcerations and any other coexisting problems like your polyps or whatever.
Yeah.
So then you also look in the you look in the stomach and you look in the first part of the duodenum. All right. So that's the gold standard. All right. Because we said ulcers are that particular sort of area where you have islonza.
Yeah.
So what then happens is most of the times ulcers are diagnosed based on history, where you say, I've been taking these medications for a long time, the pain is around here, it's associated maybe with, let's say when you sort of fast, the pain gets worse. In another type, when you eat something, the pain gets worse. So those that is a historical sort of type of diagnosis. But then we also have other common causes like what we call H. pylori, which is a bacteria that then we can test for in stool or a breath test. So that one, once it's there, plus the history, you can then assume and then give what we call triple therapy for about 2 weeks.
Yeah. But are they treatable? Like, can I treat them and I'm good forever?
Yes, it depends on the cause. Some are treatable, some are not. And like I said, H. pylori, for instance, it's a bacteria that is treatable using what we call triple therapy. But then there's challenges around resistance and recurrence rates. So you may find that it may be quiet for some time and then it comes back again, or it may not go away totally, where you then need to give what we call second line treatment or third line. If it's due to medication, stoppage of the medication will then sort you out as well.
And I suppose, you know, some of the lifestyles that people lead, they are not really aware that they could be causing themselves ulcers. You've mentioned the issue of drinking and how they, you know, try to, you know, counter that effect of, you know, going for over-the-counter, whatever they do there, and then it exacerbates or causes ulcers. I think such is very important for us to discuss here because, you know, with them getting this kind of information, they can make better decisions, as well as the issue of fasting that you've mentioned. And, you know, some people just, you know, want to hold on to, I have to fast, but, you know, they neglect what it could do to them. Let's talk about, you know, the services that you've just mentioned in terms of, you know, how you diagnose ulcers. Are you able to offer that at the clinic group? Do you have that kind of technology in Eswatini?
Yes, we do have. It's actually quite available in the private sector and even in the public hospitals. So, like at the clinic group, we do have it. Dr. Okelo does it, our resident surgeon. Yes,
Okay.
so he does it at least twice a week.
Is it affordable? Is it how expensive is this? Yeah.
Okay, it's a minimally invasive procedure,
Okay.
short in terms of duration, so it's quite affordable. It's
Yeah.
it's not going to cost an arm and a leg.
Yeah,
It's quite
and
affordable.
I know people, every time you mention sedation, they tend to run away. I think you mentioned it requires light sedation, didn't you?
Yes, we normally do it under light sedation, but
Yeah.
in some settings, you can usually be given a local anesthetic around the mouth. Then
Okay.
it's just done with you looking, but there's that risk of, gagging with you being aware of what's happening.
Yeah. Interesting.
Yeah.
Dr. Kudzai, thank you so much for coming to the show today. Hopefully next week you'll come back again to teach us more about health issues.
Thank you.
Yeah.
All right.
Dr. Kudzai Ndlovu from the clinic group just telling us about abdominal pain, its causes, how it can be diagnosed, and how the things that you should be aware of really as a person leading your own life, the kind of lifestyles that you should lead. Let's take a quick ad break. We'll wrap up the show with Lungelele.